We're talking this morning about some of the grave dangers of isolation in this pandemic, its impact on Canadians' mental health, and the physical threat to people who are not safe in their own homes. There are troubling new numbers to tell you about, showing the rise in rates of domestic abuse across the country. Federal consultations have uncovered a 20 to 30% increase in gender-based and domestic violence in parts of the country. Canada's Minister for Women and Gender Equality, Maryam Monsef, tells CBC News these numbers come out of discussions with frontline organizations and the provinces and territories. Now, there's no data yet on exactly where those cases are happening, but Minister Monsef says calls to one women's shelter in the Toronto area have gone up by about 400%. So we want to focus on that for a few moments, on the issue and help if you need it. Back with us again, clinical psychologist Dr. Vivien Lee, who's the founder of the Centre for Trauma Recovery and Growth, who specializes in trauma, PTSD, depression, and anxiety. She is in Toronto with us this morning. And Dr. Lee, thanks for staying around for another hour. Another expert to whom we have spoken on this said that COVID-19 has created an enormous pressure cooker. That's how this expert framed it. I'm wondering if you could talk about the relationship, the effect of COVID-19 on the domestic situation, the consequences of COVID-19.
Pressure cooker is exactly the right description here. It's a perfect storm for these kinds of situations. So of course we have increased stress for many families, particularly financial, and then of course people having to self-isolate at home. So there's not really too much escape if you need it, and for family members who may have been victims of violence or abuse, they're not getting that respite or that reprieve from abuse that they could normally get, even just going to work, or for the children going to school, or even things like running errands and getting out of the house. There's very little of that now, and so with this increased stress, of course, there's often increased substance use and, taking out that stress on people around you. And we know an important dynamic in abusive relationships is control. So the perpetrator of the abuse, is often exerting control over those in their family. And when you feel that you don't have much control over other areas of your life, if you've been laid off or you have financial concerns, and you're just feeling that lack of control, you're going to be more likely to take control wherever you can, and that might be family members for some people.
And again, from the minister to us, the reports of 20 to 30% increase in domestic violence in some parts of the country, and calls to that one Toronto shelter up by 400%. And yet on the other side, we've been hearing from some shelters that there's almost, they call it an eerie silence, that their call numbers have dropped right off. Can you tell me what the concern would be there?
I saw in the news as well that people may not realize that shelters are still open, so that might be a common misperception. But I think one aspect of control in a household may be monitoring of phone use or internet use. So if I'm in a household and I can't, go to a public library or do Google search at work, it's going to be very difficult for me to do an internet search if I'm not tech savvy, or to phone around and try to find supports. And then especially if you're in a rural area or you're living in poverty and you don't have access to high speed at all anymore, including libraries, then how would you know what's out there? Because you can't really do a search. So I think there's multiple factors. And then of course some areas which are isolated geographically, even if they could find out where the supports are, how could they get to a shelter, let's say that's 100 kilometers away? So I think there's multiple factors that are leading to the decrease in contacts to shelters.
So thinking of people watching us this morning, either people who themselves are experiencing violence or thinking they know someone who may be experiencing violence, I would like you to speak to them. Let's begin with maybe if you have a friend or a family member that you know or believe is experiencing violence in the home, what is your advice to that person?
Keep reaching out, keep checking in. You may not get direct answers, if you're worried about abuse, but just keep letting your friend or family member know that you're there to support them whenever they feel that they're ready to make that move or, want to leave. If you can get them on the phone where they have a bit of privacy, maybe try to come up with some kind of code word. So when that friend or family member is ready to reach out for help, that they can just let you know that code word, and perhaps you have a plan in place to reach out to them. It's difficult because we feel we feel anxious about intervening and potentially making things worse. So the more you can just keep reaching out and let the person know that you are there and ready to help, the more likely they'll be able to contact you in the future.
And to someone who may be in the home experiencing violence and it's exacerbated by the tension of COVID-19, you mentioned it just a moment ago, the awareness that in fact shelters are open, and we're going to be giving some numbers in just a second. But what would you say to that person in the home needing help right now?
I know it can be frightening. We know it can be when someone tries to leave an abuser, that might be the most dangerous time. So of course it's frightening. So trying to set up any plans, resources, supports that you can, contacting anyone who might be able to help. I know in Toronto, for example, anyone can call 211 for multiple reasons, and if abuse is one of them, then they can try to get connected to supports there. So any kind of plan or support that you can put into place. It is scary. It is absolutely anxiety-provoking to leave, especially considering childcare and finances. But your safety and your children's safety is of utmost importance. And if worse comes to worse, please don't hesitate to call 911.
The government so far, the federal government, has committed $50 million to women's shelters, to sexual assault centers, to similar facilities in indigenous communities. Is there more to do here? Is there another greater role to play, do you think?
I think the more that we can raise awareness of the potential for abuse and how to access help will be important. So if public figures can, when they're addressing the public, if they can, announce a central line or a central website that people can contact for resources. If people can put resources in public places, for example, most people are still going to grocery stores. So even putting up, just signs in those places with numbers or websites that people can access, the more that we can raise awareness of there are supports, people are there to help you, and this is how to get in touch, which is, of course, a key message. That the more we can do that, the more we can raise awareness, the better.
Well, you have helped do that this morning, and I appreciate your time and expertise as always. Thank you.
Thank you.
Dr. Vivien Lee, a clinical psychologist in Toronto. And let us remind you of the resources that are available for victims of domestic violence. If you need help finding a safe place, Shelter Safe is an online service for women and children right across the country. So it's sheltersafe.ca/findhelp. And as Dr. Vivien Lee just mentioned, you can also call 911 anytime if you are in immediate danger.